The first module is the Exam Advisor. The Exam Advisor is a comprehensive tool used to facilitate the communication of complex eye care topics within a patient visit. Both physicians and office staff can use the Exam Advisor to quickly illustrate anatomy, related conditions, and available treatment options during the consultation. There are 5 main anatomical areas available: anterior view, head front view, eye cross-section, head visual pathway, and posterior view. Each section provides in-depth information about that particular topic area. To illustrate the utility of the Exam Advisor, we will walk through 2 examples. Let us first consider a glaucoma patient. Glaucoma can be found by clicking on the eye cross-section area. You will note that the cross-section of the eye is presented. The plus signs and thumbnail images on the cross-section indicate areas of additional information. In addition, you can highlight the titles of the anatomy by clicking the label button at the bottom of the screen. Anytime within the Exam Advisor, the presenter can use the mouse or stylus, if using a touchscreen monitor, to draw on the screen for additional guidance. To erase any notes that you may have made, simply click on the eraser button at the bottom of the screen or right-click your mouse. In our example, we will be using narrow-angle glaucoma as the condition. Click on the Related Conditions button and find the appropriate topic. Once this button is clicked, an additional navigation bar will appear at the right-hand side of the screen. This bar provides additional consultation resources for this condition as follows. Condition types. This button allows you to change the condition to a related type, in this case, open angle or closed angle glaucoma, for a quick comparison. Conditions view. This button will provide various orientations of the condition within the eye. We will demonstrate this shortly. Point of view. This button provides experiences from a patient's point of view in various common lifestyle settings, such as in the office, at home, and driving during the day or night. This section is an effective way to demonstrate how a condition may worsen over time. Treatment options. This button provides generic alternatives for treatments available to the patient. This section allows you to go directly to the recommended treatments and describe them more fully for the patient. Testing options. This button illustrates various testing options available to monitor the condition over time. Risk factors. This is a quick reference to show what risk factors may exist and contribute to this condition. Related media. This button pulls only narratives related to the condition that you are currently viewing, in this case, the glaucoma content. At the bottom of each condition view, you will find a progression bar. The progression bar will help you illustrate how the condition may worsen over time. You can either manually click to show incremental deterioration, or click the far right button to show all stages in succession. In this example, the progression illustrates the pressure building within the eye. Now let's use the Condition View tab to show different orientation of the condition and the progression of the disease. The screen now shows a cross-section of the optic nerve. When the progression bar is clicked, your patient will see the damaging effect that increasing pressure has on the optic nerve over time. You can now use the Point of View button to relate this condition to the patient's daily routines. This screen represents a common daytime driving experience. When the progression bar is clicked on this screen, the patient will see the possible deterioration of their eyesight over time as the disease progresses. Now you can discuss the importance of treating this condition. The doctor can then select treatment options and discuss, for example, the recommendation of oral medication. At the bottom of the page are all of the treatment options, so you can quickly click and toggle to the appropriate options for this patient. You can return to the prior screen at any time by hitting the back button, located at the upper left-hand side of the screen. You can also hit the Exam Advisor shortcut next to the back button to return to the main Exam Advisor home screen. For the second example, let's consider a discussion on cataracts. Let's click on the head button next to the back button to return to the first screen of the Exam Advisor. Now we'll find the cataracts content within the anterior view section. On the anterior view main page, you will see a series of 6 quick links on the left and right-hand sides, as well as the related anatomy and related condition menus. For the cataract example, we will select the anterior segment quick link. This view will now zoom to the anterior segment. Remember, you can draw on any screen of LUMA by using your cursor and quickly erasing it by right-clicking on your mouse. From this view, we will select nuclear cataracts from the Related Conditions menu. Again, you will see the navigation bar appear at the right-hand side and the progression bar appear at the bottom. As with the glaucoma example, the progression bar is used to illustrate how cataracts may progress over time. You can change the orientation of the cross-section by selecting it from the Condition View tab. You can show the patient's point of view at the office. From there, you can segue into available treatment options. Note that all of the available treatment options are presented at the bottom of this page for easy reference and comparison. Now that we have reviewed the Exam Advisor module, let's discuss how to use the Media Center to find content and build playlists.